New research in people with a cluster of heart disease risk factors has shown that consuming green tea extract for 4 weeks can reduce blood sugar levels and improve gut health by lowering inflammation and decreasing leaky gut. Researchers said this is the first study assessing whether the heal. There is much evidence that greater consumption of green tea is associated with good levels of cholesterol, glucose and triglycerides, but no studies have linked its benefits at the gut to those health factors, said Richard Bruno, senior study author and professor of human nutrition at The Ohio S. The team conducted the clinical trial in 40 individuals as a follow-up to a 2019 study that associated lower obesity and fewer health risks in mice that consumed green tea supplements with improvements to gut health. In the new study, green tea extract also lowered blood sugar, or glucose, and decreased gut inflammation and permeability in healthy people, an unexpected finding. What this tells us is that within 1 month we're able to lower blood glucose in both people with metabolic syndrome and healthy people, and the lowering of blood glucose appears to be related to decreasing leaky gut and decreasing gut inflammation, regardless of health status, Bruno said. Articles on the glucose results and lowered gut permeability and inflammation were published recently in Current Developments in Nutrition. People with metabolic syndrome are diagnosed with at least 3 of 5 factors that increase the risk for heart disease, diabetes and other health problems: excess belly fat, high blood pressure, low HDL, good cholesterol, and high levels of fasting blood glucose and triglycerides, a type of fat. The tricky thing about these risk factors that constitute metabolic syndrome is that they are often only slightly altered and do not yet require drug management, but still impose great risk to health, Bruno said. Most physicians will initially recommend weight loss and exercise. Unfortunately, we know most persons can't comply with lifestyle modifications for various reasons, he said. Our work is aiming to give people a new food-based tool to help manage their risk for metabolic syndrome or to reverse metabolic syndrome. 40 participants, 21 with metabolic syndrome and 19 healthy adults, consumed gummy confections containing green tea extract rich in anti-inflammatory comp. The daily dose equaled 5 cups of green tea. In the randomized double-blind crossover trial, all participants spent another 28 days taking a placebo, with a month off of any supplement between the treatments. Results showed that fasting blood glucose levels for all participants were significantly lower after taking green tea extract compared to levels after taking the placebo. Using a technique to assess sugar ratios in urine samples, researchers also found that with green tea, participants' small intestine permeability favorably decreased. That absorption of gut-derived products is thought to be an initiating factor for obesity and insulin resistance, which are central to all cardiometabolic disorders, Bruno said. We did not attempt to cure metabolic syndrome with a 1-month study, he said. But based on what we know about the causal factors behind metabolic syndrome, there is potential for green tea to be acting at least in part at the gut level to alleviate the risk for either developing it or reversing it if you already have metabolic syndrome. Bruno's lab is completing further in. This work was supported by the U.S. Department of Agriculture and the Ohio Agricultural Research and Development Center at Ohio State. Ohio State co-authors of both papers include Min Zeng, Jeffrey Sasaki, Cici Cao, Yael Vodovats and Joanna Hodges. Note: content may be edited for style and length. Joanna Hodges, Min Zeng, Cici Cao, Avinash Pokala, Shahabuddin Rizai, Jeffrey Sasaki, Yael Vodovats, Richard Bruno. Current Developments in Nutrition, 2022. 6, Supplement_1, 981 doi, 10. 1093, CDN, NZAC068. 010 Ohio State University. Green tea extract promotes gut health, lowers blood sugar. Study shows potential to reduce risks of metabolic syndrome. Science Daily. https://ift. TT, Q8HGUJD. Access July 26, 2022. Thanks for watching. Please subscribe my channel for more videos.